A broken leg. Today, it's painful, but rarely deadly. But during World War I, a fracture of the thigh bone was often a death sentence. Not because doctors didn't care, but because they didn't yet understand how to save those patients. The femur, your thigh bone, is the strongest bone in the human body. But when it breaks, it becomes incredibly dangerous. Inside the thigh run some of the largest blood vessels in the entire body. When the femur fractures, these vessels can tear, leading to massive internal bleeding. A patient can lose up to 2 liters of blood from a single fracture. And that's not all. Severe pain triggers shock, blood pressure drops, organs begin to fail. Now imagine this, a wounded soldier on a battlefield. No proper equipment, no stable transport, just chaos. Every movement made things worse. As stretcher bearers carried the injured, the broken bones shifted. Sharp fragments cut deeper into tissue. More bleeding, more damage, more shock. By the time they reached a field hospital, many were already beyond saving. Statistics from early World War I showed that nearly 80% of soldiers with femoral fractures died. Medicine had knowledge, but lacked one crucial element: transport and stability. Before the invention. Long before the war, a British surgeon from Wales had already identified this problem. His name, Hugh Owen Thomas. He came from a family of bone setters and spent years treating fractures. Unlike many doctors of his time, Thomas believed something radical, that rest and immobilization were more important than intervention. He observed that patients who moved less survived more. So he designed a device, simple but precise. A long iron frame that extended from the hip to beyond the foot. It supported the entire leg and held it in alignment, preventing movement, preventing further injury, and most importantly, reducing blood loss. This device became known as the Thomas Splint. But at the time, his ideas were not widely accepted. Many doctors preferred more aggressive methods, and the splint was largely ignored. World War I, the turning point. Then came World War I, a conflict on a scale the world had never seen before. Thousands of soldiers arrived with devastating injuries, and doctors were overwhelmed. That's when the Thomas Splint was rediscovered. Medics began applying it directly on the battlefield before transporting patients. The leg was fixed in position, stabilized completely, and for the first time, the results were undeniable. The death rate dropped dramatically, from nearly 80% to less than 20%, all because the leg was no longer moving, bleeding was controlled, shock was reduced, and patients reached hospitals alive. The Thomas Splint worked because it addressed the root problem, not just the fracture, but the consequences of movement. By immobilizing the limb, it prevented further damage to blood vessels. It reduced internal bleeding, maintained alignment, and stabilized the entire body. In modern terms, it bought time. And in trauma care, time is life. After World War I, the Thomas Splint became standard practice. It revolutionized emergency medicine. For the first time, pre-hospital care made a measurable difference. The idea was simple but powerful. Treat before transport. Stabilize before movement. Today, this principle is fundamental. From ambulances to emergency responders to trauma surgeons, the concept remains the same. Modern splints, traction devices, and immobilization techniques all trace back to this one invention. Sometimes the most important breakthroughs are not about new technology. They are about new understanding, seeing a problem in a different way and solving it with clarity and simplicity. The Thomas Splint did not just change fracture treatment, it changed survival itself. It turned a deadly injury into a survivable one, and in doing so, it saved millions of lives and reshaped the future of emergency medicine forever.